Project started pretty much with a conversation with Sally Hartman, looking at the possibility of doing whether it's medication delivery, supply delivery in a rural area would be something that we could accomplish here. I immediately thought about Tangier Island. Tangier is very underserved. We do have a primary care practice on the island. We have a physician assistant on the island, but their ability to get supplies or medications is limited based on their ability to get to a pharmacy. So when Annette sees a patient and prescribes a medication, that prescription goes to Crisfield. Those patients then have to wait until there's enough mail on the mailboat. Could be a standard blood pressure medication, it could be antibiotics, could be steroids, depending on what's going on with the patient. And if we can work on a process to be able to deliver medications to them a lot quicker, then we're helping the healing process faster than what can currently happen. And we can accomplish this specifically for Tangier is those prescriptions would come to us, whether it's Pavilion Pharmacy or here. And then our pharmacy team can package, put together, put it in the box and get it ready for takeoff or for launch. They will deliver the medication over to the island, and then the patients can pick up their prescriptions from the practice on the island.
So we're going to be using DroneUp's proprietary aircraft. It's a coaxial X8, meaning it has 4 arms, 8 motors, and it even has a parachute for safety. This aircraft is a heavy lift delivery drone designed for package delivery. In this use case, we'll be using it to deliver medical supplies to rural and suburban areas and single-family homes for their medication throughout the day and nighttime. For a standard delivery process here at Riverside, the Riverside pharmacists will pack and prep the medication or supplies, and then those will be handed off to the DroneUp team. They will then verify the items in the package and make sure that it's all approved for flight. Then the DroneUp pilot will load the package onto the aircraft. The autonomous flight path will be built to the delivery destination. The pilots will then make sure the area is clear of all people, and then they will click takeoff. It'll then follow the flight path out to the delivery address. The DroneUp pilot will then verify that the area is clear, and they will deliver the package from about 80 feet from its en route altitude. Once the package is delivered, the puck and winch system reels back up into the aircraft, and then once the puck is captured, the drone will then ascend back up to its en route altitude from 80 feet, and then it will autonomously fly back to Riverside Hospital and land back at our station.
As we expand it and we can apply it to the shore, transportation and access to healthcare has always been one of our challenges here on the shore, being in a rural area. We do not have a lot of public transportation that really comes off Route 13. So those patients would still have to leave their house, drive to the post office, or walk to the post office within town to be able to pick up their medications. For some of our patients that are elderly, that's just not doable, and they rely on family, friends, church members, just the community to be able to help with that. So our ability to be able to deliver that medication to their doorstep can hopefully increase medication compliance, med adherence, and we're looking at this study to see if we can actually, over a period of time, improve the health of our population by helping them access their medications and/or medical supplies in a timely manner.